I like to start off with a quote from famous actor Bill Murray. There's only a couple of times when fame is ever helpful. Sometimes when you're trying to get into a restaurant before it's closing, or sometimes when you're trying to get out of a traffic violation. But there's only one time when fame is really ever helpful, and that's when your kid is in the emergency room. I'd like for you to sit and think. How would you like it if you were in the emergency room and someone famous walked in, or someone with better health insurance walked in, and they received care before you? After all, this could be your first time visiting the hospital. In 2016, the CDC reports 12.6 million emergency room visits resulted in hospital admissions. A report from RAND, a public health initiative, states that half of U.S. hospitals are overcrowded and two-thirds of them are in urban areas, with a continuous growing number of specialists who are unwilling to take ER calls. A doctor, Margaret B. Greenwood, states that rural hospitals face a shortage of physicians, of service patients, and financially strained hospitals. And rural hospitals rather produce limited services that will not increase the quality of healthcare distribution, which stunts the growth of healthcare. In order to address these limitations, I developed a concept called the honest physician's duty. Honest Physician's Duty is an innovative, patient centered approach which health administrators can deliver. This is a solution to target underserved hospitals in urban and rural areas of our nation. Honest Physician's Duty seeks to reduce overcrowded emergency departments, providing access to urban and rural areas to help with health administration, where health administrators can deliver an initiative which will be titled Honest Physician's Duty. Honest Physician's Duty will be centered on using telecare and telemedicine. Telemedicine and telecare will provide medical care on a more accessible basis. In order to make this initiative attractive, the physicians and nurses dedicated to the Board of Physicians will be incentivized to complete a number of helping service hours in emergency departments, urban areas, rural hospitals, which will include home visits per year with the practicing professional. Like jury duty, health professionals will be chosen from a random selection of 25 days out of a 12-month period. Um, which will be dedicated to reducing the need which will be dedicated to meeting the need in underserved hospitals. A part of the initiative will help will use telehealth as a strategy that works on implementing a large scale of implementation of primary care services to rural hospitals. This could help challenges such as cost and reimbursement, along with the benefits of physicians who are willing to participate, can increase communities' health awareness. Honest physician's duty will be defined as an active period of time a health professional dedicates his pledge of service as a physician to servicing the needs in the healthcare community that are underserved and met. This solution is expected to reduce doctors, healthcare specialists, and healthcare professionals and from burnout. Health administrators could consider randomized distribution of healthcare services, which will also help diversify the delivery of honest physician's duty and also provide, which will also help um, benefit the reduction of burnout. The Honest Duty program serves as a civic duty to help reduce emergency room visits, the lack of specialists, nurses, and physicians via case management. Because we know doctors and physicians are not attracted to working in the emergency department, rural areas, we will use telecare and telemedicine as a strategy, which will allow them to consider the incentive of being paid where they don't have to travel as much. Health professionals will also receive an increased salary of 15% or average, which will help them be a part of the Honest Physicians Duty program. So now back to my question. What if a celebrity or a famous actor walked into the emergency room department and received care before you? How would you feel? With medical strategies such as at telemedicine and telecare, you could avoid an emergency room visit. Even so, could you have received care? Thank you.